Hello, and thank you for joining me. My name is Nikki Koziel. I am the Director of Quality Care, and today we're going to be investigating emergency department wait times within our facility. So this presentation is intended for emergency department physicians at our hospital, and this is relevant because there recently has been some concern regarding the wait times for patients within our emergency department. So several physicians have come forward to me with their concerns, and they have each posited different average wait times that they have calculated. So the purpose of this presentation is to briefly explain different ways of calculating the average, to determine the best way of reporting the average emergency department wait time, and we're also going to discuss who we report that data to. So learning objectives for today, we're going to be covering different methods of determining measures of central tendency. So we're going to discuss the mean, the median, and the mode. We're going to answer, how does our hospital calculate ED wait times? Who do we report this data to? And how does this affect various stakeholders? So here we have the data that the physicians are making their calculations from. And this is the data from 30 patients and the time that they spent waiting in our emergency department on one day last month. So each doctor provided me with a data set of the 30 patients that their calculations are based on. And one physician reported that patients are spending 180 minutes waiting in the emergency department before being seen. So based on the data provided, I can see that this physician calculated the mean. This is also known as the mathematical average. So here they added the sum of all the wait times in minutes, which was 5,412 minutes, and they divided it by the number of patients. So when you do the math there, it comes out to about 180 minutes per patient. So in many cases, the mean is the best way to calculate the average, but in this case, it's affected by outliers. So outliers are numbers within a data set that can either be very high or very low. So here we have some low outliers here, and then we have some much higher numbers here. So these outliers can definitely affect the value of the mean. So the next physician reported that patients were waiting an average of 126 minutes. And if we look at the data set, we can see that 126 was the most common number that came up as far as the wait times. So the value that is most common within a set of data is known as the mode, and the mode is what they were reporting as the average value for wait times. And lastly, we have 130 minutes being reported as the average wait time. So this is the value which is known as the median. And that's essentially lining up all the numbers from smallest to largest and taking the number that is at the very middle within the list. So in our list of wait times, this is 130. So how does our quality department calculate wait times? So we use the median as the best measurement of central tendency when reporting our wait times. And this is because the median is the standard measure of wait times that is submitted to CMS for quality reporting. So we need to use the same metric as all the other hospitals so that our patients and other stakeholders are comparing the same value across different medical facilities. So ED wait times are related to both timely and effective care, and shorter wait times have been clinically proven to lead to better patient outcomes. And of course, that is what we all want. So the Hospital Outpatient Quality Reporting, or OQR program, is a quality data reporting program implemented by the Centers for Medicare and Medicaid Services for outpatient hospital services. And under this program, hospitals report data using standardized measures of care to receive the full update to their outpatient prospective payment payment rate. So this means that the data that we have, we are reporting to CMS. And timely and effective care in hospital emergency departments is essential for good patient outcomes. Delays before getting care in the emergency department can reduce the quality of care and increase risks and discomfort for patients with serious illnesses or injuries. So CMS reports this information on their Care Compare website. So this information is all based on information submitted to the hospital outpatient quality reporting program. And from here, patients can find a wealth of information on many different medical centers and across many different data points. And this is a really handy tool to find the average emergency department wait times. So if we open up this website, find and compare providers near you. So we're going to go to hospitals, and you can go by zip code, or you can also look up by type of hospital. So here we're going to look at Community First Medical Center. And here we can see overall star ratings, patient survey ratings. Looks like it's not a very great hospital. Here we go to quality, timely, and effective care. And this pops up and we can look at different data points like sepsis care, cataract surgery outcome. And here we have emergency department care and average medium time patients spent in the emergency department before leaving from visit. So here, this hospital is reported at 227 minutes. And of course, you can look up a lot of different facilities from there. So what does this mean for various stakeholders? Well, for patients, nobody likes waiting. And patients, if they have the information, if they know which facility has shorter wait times, that's the one that they're going to go to. So shorter wait time is also correlated to better medical outcomes for them and less waiting. For medical staff, patients that have been waiting for a long time, especially if they're sick or they're in pain, they're more likely to be frustrated or rude or just in a poor physical condition. So I would ask, would you rather encounter a patient that's been waiting for 15 minutes or for 3 hours? I think we all know the answer to that. And shorter patient wait times lead eventually to a better work environment. For hospital administration, longer wait times really impact our bottom line. So longer ED wait times indicate the need to make changes. If patients are going to go to a facility that has a shorter wait time, then that's going to impact that bottom line positively. If they're going to avoid hospitals that have a longer wait time, then that hospital is going to suffer. So this may mean making staffing adjustments, altering the triage process to be more effective, better training of staff, making adjustments to the EHR system to streamline the process, amongst other changes. So how do we compare? So our hospital's average median wait time is 130 minutes. And from the CMS reported data on medium volume hospitals, which is us, the nationwide median ED wait time is 170 minutes. And the median wait time within the state of Illinois is 192 minutes. So we're doing really good. Congratulations. So in conclusion, we covered different methods of determining the mean, median, and mode, the measures of central tendency. We discussed how our hospital calculates ED wait times, which is the median value, and we report this data to the CMS, and we can access this data on the Care Compare website. Thank you for joining me.